Thank you. Thanks for staying so long in this testimony and the conversation today on this. This is extremely important to be able to have a dialogue and try to get facts out there, because there's been a tremendous amount of rhetoric. And I've even heard conversations today about misinformation or rhetoric or intellectual honesty and all these things that have come out in the dialogue today. And I want to be able to help bring some things together from hearing the testimony from the entire day on this. Ms. Hackler, just to clarify on this, are there any states where women face prosecution for having an abortion?
No.
Are there any states that criminalize miscarriage?
No.
Or that care for for a miscarriage?
No.
Are there any states that criminalize removing an ectopic pregnancy?
No.
Are there any states that prohibit life-saving care for the mother?
No.
Are there any states where women have to be actively dying for a doctor to be able to act for her care?
No.
There's been a lot of rhetoric in this that I'm concerned pushes people away from getting access to health care. Vice President Harris, in a speech recently, said that women were being arrested and facing prosecution for experiencing miscarriages. Ms. Hackler, do you know of a single instance where a woman has been arrested for having a miscarriage or getting health care for that?
No, treatment for miscarriage is allowed under the law, and there have been instances where I think that one example of that that's been pointed to is misleading, because the woman, I think she was in Ohio, the charges against her were not abortion related, and so it's misleading to use that as an example.
It's not only misleading, but it scares women away from getting access to health care, and it leads women to not go get health care treatment when they desperately need it. Dr. Francis, there's been a lot of conversation about chemical abortions. Obviously, we have recent cases of Candy Miller dying from a chemical abortion. FDA has changed the rules of late to be able to say, don't give us information about consequences, don't even report that, don't turn it in. You don't have to get to a doctor to be able to get access to chemical abortions. There's been lots of conversations I've heard from my Democrat colleagues saying chemical abortions are as safe as Tylenol. Can you tell me a little bit more about chemical abortions?
Absolutely, thank you. And I would like to correct the record in saying that complications related to these drugs are rare. We know, per the FDA's own data, that 1 in 25 women who take these drugs will end up going to the emergency room. And a recent study that came out actually showed that emergency room visits related to chemical abortions were significantly more likely to have a severe diagnosis code associated with them than were visits after surgical abortion or even visits after a live birth. So women are going to the emergency room for severe complications like infection. You know, back in 2006, Congress did an investigation actually after several women died from the same kind of sepsis after taking these drugs. Congress has known about this since 2006. It has continued ever since. And that is what Amber Thurman died from, and it's what Alana Dixon in Nevada died from, infection related to taking these abortion drugs. Incomplete abortion, where all of the tissue from all of the fetal tissue and placental tissue don't pass after taking these drugs, occurs in 5 to 10% of women. That may sound like a small number, but when you look at the number of chemical abortions that are done in this country every year, that's a significant number of women that are experiencing this complication. These are not as safe as Tylenol. Tylenol complications occur when women, or when anyone overdoses on Tylenol and then goes to the emergency room. These complications are occurring when women take these drugs per the FDA, how they are indicated, and they're going to the emergency room at a rate of 1 in 25. These are not safe drugs, and women deserve to have accurate information about that.
Dr. Francis, FDA has changed the rules where you don't have to have access to a doctor or have a doctor review, examine you, anything on that to be able to get the drugs to you. What are the risks there, receiving just chemical abortion drugs in the mail and not having a doctor do any kind of examination leading up to that?
This is extremely risky and should actually be considered medical malpractice. Without a woman seeing a physician or another medical professional, we can't confirm how far along in her pregnancy she is. We know, according to even the FDA's own data, that the farther along in pregnancy a woman is when she takes these drugs, the higher the risk of complications. And the American College of OBGYN says that up to 40% of women will be wrong about how far along they are in their pregnancy based on last menstrual period alone, that ultrasound should be used to date a pregnancy. So we can't know how far along she is in her pregnancy. We can't know that she does not have an ectopic pregnancy, which are very common and are life-threatening. We also can't screen her for Rh disease to know if she's Rh negative and needs a medication called Rogam to prevent complications in future pregnancies. All of these things could be done if a woman was being seen in person by a physician or another medical professional prior to receiving these drugs.
But the rules have changed on that. That's no longer required.
Right.